Hi guys, it's Dale with the insurance. Today we're going to talk about it's a confusing topic, but very important. And it gets mundane if you kind of follow it. But for small business owners, this could be a good nugget of information. The title of the article is "The Good and Bad About Association Health Plans," right? Health plans in general, kind of navigating them is like navigating a maze, right? And that's because of all the legislation that has impacted it over the years, right? This article in particular talks about the latest legislation, which allows association health plans, AHPs basically, to provide group coverage, right? And AHPs are exactly how they sound. It's kind of a group of people that share either a common profession, they're in a common industry like the restaurant industry, or they're in kind of a geographic region, right? They essentially band together to spread the overall insurance costs over the group, right? Lowering the costs. And they also get to kind of tailor coverage to the members in the group, which share common risk characteristics, right? So, like if you're in the restaurant industry, you obviously share common risks working within a restaurant, just like every other member, right? Just like anything, there are benefits, there are drawbacks. Some of the benefits with AHPs is, quite frankly, they can price discriminate, right? So they can set premiums according to a member's risk characteristics, right? According to their health. So if you're a young, healthy individual, you will get a low-cost option. You will have a lower premium. Obviously, Obamacare is not like that. A second benefit are the ability to tailor coverage to the group, right? So, for example, if this group, on average, needs more than the one annual checkup, you need multiple annual checkups, then they can tailor coverage or have better coverage for annual checkups than the normal policy, right? And then the last thing is, and most people find this as a nuisance, but there is no open enrollment period, right? There is no OEP. You can join whenever you want. So those are all kind of pretty solid benefits. There are some costs to it. Kind of the biggest drawback, I would say, is the coverage option, right? There's no uniform coverage. So a lot of the policies can be very skimpy in terms of what's covered from a healthcare standpoint. The second thing is pricing, right? Pricing is good and bad. It's good if you're healthy, bad if you're not. So pricing, if you're a young, healthy person, sure, pricing is going to be great. But if you happen to not be healthy and really need coverage, it can get quite unaffordable, right? And the last drawback kind of dovetails to the second one, in that it creates a imbalance within the market, right? Because you can imagine the healthier individuals within the country gravitating to AHPs, right? And not going through kind of the marketplace, the Obamacare marketplace. And that kind of leaves carriers fitting the bill and losing money because they're required to cover the nation's most sick, right? Those in most need of coverage. So hopefully that was kind of helpful. AHPs aren't necessarily bad, may be a good option for a business owner or a member. I would just say be very aware of what is covered. And then, and this is always the case, I mean, with any insurance, but definitely with health, don't allow pricing to completely dictate your decision, right? So be aware of what's covered, and don't be completely driven by price. Hopefully this was helpful. Thanks for stopping by. We'll talk to you next week.